had one course of prednisone by that time, and she was given that course of prednisone because she was not feeling well, right?
So
I'm just verifying that. This is the information that you guys provided.
Let's define not feeling well.
Well, why did she come here to begin with?
No, not for you. Sorry. So I'm going before you. So your
No,
visit.
so
by the time we got
story,
to you.
the story you told
yes,
me
sir.
was she
Yes,
had not
sir.
been feeling well for the past year. She had pain in multiple joints, progressively getting worse. Then she noticed a rash across the face, forehead, upper back, buttocks. The rash was, the forehead was very itchy. She had been treated with some anti-inflammatory medications and 1 week course of prednisone, which did not really help her much. This had already been done before she got to see me.
Yes, sir.
When I saw her, she had a swollen wrist,
Yep.
and she had a rash across the forehead, okay, and she had a rash across. This was after 1 week course of prednisone, which somebody else had given her.
Yes, sir.
And I said, well, it looks like she's got some sort of an inflammatory arthritis. So I saw her 10/14. Then I saw her on November. No, I spoke to you on the phone. Where she was not much better, and we discussed, you would say, okay, we would like to try methylprednisolone, which is a different variant of steroids. So I said, okay, fine, let's do that.
Right.
So I was the one who started on the methylprednisolone, and she was no better when I saw.
With the drug-induced lupus, would you say?
Typically, you take them off the drug, which is offending agent, and they get better.
Okay.
With the positive histone, usually it's the drug-induced thing, and you try to identify a drug which caused that, and there's a list of drugs, you can look them up, which are most likely to cause drug-induced lupus. You take them off, and sometimes it's not possible to take them off the drug. I just had a patient today. He is a psych patient. He's on a drug which is causing drug-induced lupus, but the psychiatrist refuses to take him off the drug because it has helped his bipolar disorder so much better.
And then you can't just stop abruptly. There's complications with stopping things,
Yes,
depending
yes,
what
yes,
medication.
yes.
If somebody had normal blood work, didn't have the rash, didn't present any symptoms of lupus outside of joint pain, that I probably wouldn't have, because there was no diagnosis. The only diagnosis they had was joint pain, and then they prescribed prednisone. I don't think.
Oh no, this is done all the time.
It's done all the time.
It's done all the time. You don't wait for a diagnosis to treat people. If people in the ER are using Medrol dose packs like water. And sometimes you're right, and sometimes you're not right. That's just the nature of the business.
The human body is very. That's a possibility that no one wanted to consider it, and because I mean, look at if it wasn't, then the 60 milligram dose that popped her pancreas shouldn't have popped her. That should have helped if it, I don't know, but I appreciate you talking to me, and I don't know if you would want to look at any of this. And
no, why don't you email it to me? I would want to look at it.
I would appreciate that.